So you do a lot of cosmetic dentistry.
We do, Randy.
Like, who's a candidate for this?
Just about
Porcelain
anybody.
veneers.
Porcelain veneers. Just about anybody. Somebody that has crooked teeth that we can instantly do orthodontics on. We have case after case after case of patients who have had crowded, crooked teeth that we have transformed their smile in 2 appointments, Randy. You come in the first appointment, generally about a 2-hour appointment. You'll leave with temporaries that are a mock-up of the final product, so you can preview your smile.
Is that right? Okay.
Absolutely. We call you the next day. We say, hey, how do you like everything? We keep in touch with you, because if something's a little bit too long or you don't like the look of something, I can then go back and tell the lab guy, we need to change this about it. So when we see you the following week, it's just 1 week with those temporaries. We get you back in. We try in the final product, make sure that you like the shape, the shade, everything about them. And once you're happy, we get those bonded in place. I had a story about myself about 15, 20 years ago. I had nice teeth when I was a kid, always had a nice smile as an adult, young adult. And a dental assistant said, hey, when are you going to do something about your teeth? I said, what do you mean? And they said, well, they're chipping and they're discoloring a little bit. I said, what do you mean? They said, pick up the mirror. And I looked in the mirror and I'm like, holy cow. So I had porcelain veneers done. And the number one concern that I had, even though I'd done numbers of them, hundreds and thousands of them, and I haven't had complaints from patients, is, will they feel like my own teeth? They absolutely feel like my own teeth. So your
smile, those are veneers. Let's see those. Let's see it. Yeah,
yeah.
They look natural.
Natural. Perfect. And that's what we do. We don't make things obvious. You'll see, we see patient after patient. Then, the patients won't go to, their friends won't go to them, oh my God, you had something done with your teeth, because they don't stand out.
But everybody sees those big veneers. Whose idea is that? The patient or the dentist?
I have no clue, because I wouldn't put those on a patient. If you can see, if you look at somebody and you see, oh my God, there's opaque teeth, if those are porcelain veneers, they weren't done right. It should be a natural look. It should be something. I have patients, men, that'll say, people think, there's something different about you. Did you used to have a mustache or something like that? No, they fix their teeth, but it's not so obvious. Women, I had one, I have women all the time. They don't want it to be so obvious. This one woman said, she went to she went to a school meeting, and a friend came up to her and said, you look radiant. There's something glowing about you. She didn't know it was her teeth, because they look so natural. It's such a high-grade improvement, but it wasn't so fake that you pick up on it right away.
Now, a lot of these people getting smile makeovers, what do they call it? What do you call it?
Well, I like to call it a smile makeover.
Okay.
Because it actually is a smile makeover. And it actually will help strengthen your teeth. It can lengthen your teeth, bring back the years, the youth. We're all looking for something to look younger. And fixing your teeth is really probably the number one thing you can do.
And a lot of these people, because you offer sedation, so you don't even remember. Like, you go in, you take a pill.
Yep, take a pill.
You don't even remember
You're sleeping.
What was done.
We do our thing. You leave there with the temporaries. It's so straightforward. And like I say, we do it. The 2 appointments, they're just a week apart. You only have to be with your temporaries. And by the way, the temporaries look pretty fantastic, but you only have to be with them for 1 week, and then we get the final product the following week.
Now, if you care about the way you look, and we talked about this in the green room, you say that veneers are inevitable. Elaborate on that.
Most of us, like I said, myself, even if we use myself as an example, I had really great teeth. But from years of wear, chewing, and all these other things, clenching, grinding, whatever, my teeth got worn down. And luckily, I did it before my teeth worn into the dentin of my teeth, but a lot of patients will have that. And then we have a little bit more advanced procedures to do that, but it is with porcelain veneers, and we sometimes have to open the bite or change things, but it's certainly something that can be done.
You've had a lot of training in cosmetic dentistry?
I have been doing this for a long time. I did some originally about 35 years ago when I was in dental school. But the last 25 years or so, I've done so many cases, so many transitionarily beautiful type of things, making people's lives better, and our teeth look like teeth. They are translucent. They don't look like chiclets.